Good morning and welcome back. It's now 8:12. Cancer is the second leading cause of death globally. Just last year, it was responsible for an estimated 9.6 million deaths. But the cancer epidemic is not confined to humans. November is National Pet Cancer Awareness Month. A growing number of dogs and cats are diagnosed with cancer each year. About 1 in 3 dogs will develop cancer, and up to 50% of dogs and cats will be diagnosed with cancer in their lifetime. Joining me now is veterinary oncologist Dr. Susan Mendez with Jacksonville Blue Pearl. Thank you so much for coming in. I'm a dog lover. I have a St. Bernard. His name is Sully. Viewers at home probably know him better than they know me. This is something that's very near and dear to my heart. Growing up, we had a St. Bernard, and she was diagnosed with osteosarcoma. We amputated her front leg. She lived 2 years post-surgery with no treatment.
Wow.
Which is very remarkable from what
definitely.
I'm told. What do you want people to know, especially this month? We're spreading awareness about cancer within our feline and canine friends. What can they look for?
So early detection, just like people, is key. So there's several things we can look for. One is you want to make sure that you're feeling your pet probably monthly if you can, to see if you feel any lumps or bumps, any swellings that weren't there previously. The other thing is to make sure that you take them to their vet so they can get routine checkups, blood work, and things like that. There are some things to look for, like weight loss when you're not trying to lose weight. Any discharges that are abnormal, bleeding, vomiting, diarrhea, those are things that can occur. There's a variety of things to look for, but the most important thing is to know that you are the person that knows your pet the best. And if you notice anything that's unusual, if they're suddenly lethargic, you want to make sure that you take them to your vet regularly.
And if you notice a change, if you notice a lump, if you feel a lump, if you see a lump, don't panic. Bring them to the vets because it could be something else.
Absolutely. It could be something totally benign. It could be something like arthritis if your pet is limping. Doesn't necessarily have to be cancer, but your vet is going to be the person that's going to help you figure out exactly what to do from there.
We also should mention if the diagnosis is cancer, it does not mean that the pet could succumb to that disease. Cancer can be treatable within felines and canines.
Absolutely. There are a variety of treatments that we can use, just like there are in human medicine. There are some occasions that we can actually cure cancer with things like surgery or radiation therapy. But the best thing to do is to go talk to your vet so you can get all the options. A lot of times they will refer you to a veterinary oncologist so you can get some more specialized care, but there are a lot of options and a lot of things we can do to keep our pets alive and comfortable.
When you hear these stats at the top of this segment, when we talk about those numbers, are you alarmed by them?
It's certainly alarming, especially as a pet owner, but it's not surprising when you think about 1 in 3 people will develop cancer. And our pets share the same environments that we do, have a lot of the same genetic predispositions that humans do. So it's not at all surprising, but it's certainly alarming when you're a pet owner to hear these things.
But when we talk about up to 50% of dogs and cats will be diagnosed with cancer within their lifetime, I feel like when I was a child, our dogs back then, our cats back then, they lived to be 15 and 16 and there wasn't the number of cases that are there today. Is that because just the technology has advanced?
I think so. I think we are better at detecting cancer now, whereas before you just thought your dog was getting older and passed because it was old of something natural when there was cancer there and we just didn't know it. So I think we've become better at detecting cancer.
One question I had for a specialist that I did a story on years ago, this was shortly after St. Bernard had passed away. Why is it that cats or dogs don't lose their hair during chemo treatments if you opt to do chemo?
Yeah, that's a good question, and a lot of people are really worried about that. So certain dog breeds that have continually growing hair that's more like our hair and not fur, they will actually lose their hair. But dogs and cats, most dogs and cats won't lose their hair because they don't really have hair. It's not something that continually grows like we would have to cut our hair, like certain breeds need to be groomed. The breeds that don't need to be groomed typically will not lose their hair.
Very interesting. And we should mention too, and during that story is when I learned that the goal is not always to cure cancer with our canine and feline friends. It's to prolong their life with good quality.
Exactly.
With that said, some cancers, like you said earlier, are curable within our dogs and cats.
Yeah, certainly. Some cancers we can definitely manage. with surgery. So skin tumors, a lot of skin tumors can be cured with surgery. Certain other types of cancers, and radiation therapy is another way that we could potentially cure certain cancers, but a lot of them unfortunately are not curable. And our goal is to, like you said, manage their quality of life and make sure that our pets are comfortable. We are not willing to make pets sick with our treatments because they don't know what's going on.
Right.
So it's our goal to keep them comfortable for as long as we can.
And it's not about us, it's about them.
Exactly.
And it starts with having a conversation with your vet. If you see something, say something unusual, there are options out there.
Absolutely.
And we can go down that route if we have to.
Yeah.
Dr. Susan Mendez, thank you so much for coming in this morning.
Thank you for having me.